PPACA presentation by Ruben Luna. Healthcare Administration and Policy Seminar. Objectives: legislative branch, executive branch, judicial power, Patient Protection and Affordable Care Act, health policy, stakeholder. Legislative branch of the U.S. government. The authoritative part of the government is liable for authorizing the law of the state, appropriating cash, important to work the public authorities. The administrative part of the government is known as Congress of the United States. The Congress is made up from two chambers, the House of Representatives and the Senate. The House of Representatives is answerable for starting all income bills. The House of Representatives additionally holds the ability to reprimand the President and other government officials. Every bill that starts inside the House should likewise be passed and endorsed by the Senate and other way around. Legislative branch of the government. The Senate is viewed as most remarkable chamber or place of Congress. The Vice President of the United States fills in as the leader of the Senate. The majority rule government requires an educated populace that can transparently and uninhibitedly participate in a discussion on issues, legislative issues, and strategies arrangements. Executive branch of the U.S. government continues. The primary part of the executive branch is to execute the law, follow the Constitution, and ensure the nation is running deliberate. This branch additionally should do the everyday organization on how much cash goes to schools, local groups of firefighters, healthcare services, and so on. They continuously appropriate the spending they have. The obligations of the presidential branch manage upholding the nation's law. One of the obligations of the presidential branch is to order and direct the U.S. military. Judicial branch of the U.S. government, where the chief and authoritative branches are chosen by the individuals from judicial branch are designated by the president and affirmed by the Senate. The obligations of the legal branch include interpreting state laws, settling legislation questions, punishing violators of the law, hearing the common cases, protecting individuals' rights conceded by the state's constitution. The judicial branch is the main part of the United States government because of the huge job it plays in deciphering and deciding whether laws are established. Judicial branch, you have your federal and your state. Under your federal, you have your U.S. Supreme Court and all federal courts. Under your state, you have your state high courts and all state courts, and they both interpret laws. Protects Patient Protection and Affordable Care Act, which is the PPACA. Understanding the Protection and Affordable Care Act, likewise called Affordable Care Act, the ACA, or Obamacare. In the United States, medical care change enactment endorsed into law by the U.S. President Barack Obama in March 2010, which included arrangements that necessary most people to make sure about health care coverage or pay fines, made inclusion simpler and less expensive to get, took action against damaging protection practices, and endeavored to get control over the increasing expense of medical services. Executive branch of the U.S. government. The well-being relates law and the arrangement making measures into positive bearing inside the country. Presidential branch assumes a pivotal part. It is on the grounds that the presidential branch is mindful to convey the well-being related approaches from plan to execution, to do the plan of general well-being laws, and to keep up with participation with the administrative panel. Such branch assumes key parts. It is on the ground that the presidential branch is predominantly answerable for uses of the well-being approaches. When the approaches are formed, then adequacy of these arrangements are assessed by the branch with the goals that vital revision can be made to reach all at all the positive results of such strategies. The legislative and judicial branches in health policy. But the authoritative and the legal parts of the U.S. assume a significant part in well-being strategies. The administrative branch comprises of chosen authorities who address U.S. residents. The authoritative branch entries the public law for the whole nation, established through arrangements making as it is the law-making substance of the U.S. government. The administrative branch examines the effects of the strategy according to the recommendation of the House of Representatives and the Senate. The approach are, the approach are examined as far as shielding the individual from hurt and advance help for them. This branch additionally figures out which office or office will execute the well-being strategy. It likewise assumes an essential part in subsidizing the program, which is spent by office or division exclusively after the consent of administrative branch. Healthcare policy stakeholders. There are numerous partners engaged with general well-being strategy plans and dynamics in the United States. These incorporate patients, medical care suppliers, the public authorities, and protection suppliers, and obviously the overall population. It is imperative to call attention to that cash impact forming the discussion of medical services strategy and law in the United States as seen in the new medical care change that became law in 2010. There are obviously different partners that are on a more limited size. For example, clinical hardware suppliers, medical supply sponsors, etc. Definitions of the medical supply strategy, which as a rule of suppliers is centered around installments, is essential to these partners' gatherings. Government healthcare, which is a USA government worked medical service program, is regularly scrutinized for the law's installments per pathology proportions by this gathering. References. These are my references.